And I've forgotten what the 9 o'clock is.
Hello, and welcome to our live chat. My name is Rob Gilmore. I'm the Director of Campus Experience in the Office of Undergraduate Admissions, and it's a pleasure to be with you today as we are going to be discussing the Davis and Henley College of Nursing here at Sacred Heart. For those of you who are watching who have been admitted to the Sacred Heart class of 2024, we welcome you and your parents and congratulate you on this milestone in your academic careers to this point. This has been a phenomenal year for us at the university, and we're going to learn a little bit more about the numbers for this year's class in just a moment. But it is our pleasure to have you here today. Our interaction with you at this time is limited to a virtual experience, but that doesn't mean that we get to answer your questions and get to the information that you are looking for as we prepare now for our March to May 1st, which is going to be our deposit deadline for this year. We are now just about 45 days away from May 1st, so a little bit of time to get a lot of decisions made, and that's where we are heading right now. So over the course of the time this morning, we are going to ask that you submit your questions. We will be presenting a lot of information to you and then filtering in your question as we go. But I would like to first introduce our Executive Director of Undergraduate Admissions. She's also a fellow alumnus of mine from the class of 2007 here at Sacred Heart, Pam Pillow. Good morning, Pam.
Thank you, Rob. Good morning. Good morning, everyone. Thank you for joining us this morning. We would have loved to have hosted you on campus, but unfortunately, this virtual chat will have to do for today. Just to give you a little insight into our applicant pool here at Sacred Heart University this year, for the class of 2024, we have had our largest applicant pool and most qualified applicant pool. We have had applicants from 23 states across the nation and 10 countries. You all are among the most qualified. You are our admitted students to the Davis and Henley College of Nursing here at Sacred Heart, which is our most competitive program here at the university. So congratulations to all of you. You all should be very proud of your accomplishment. Our accepted class boasts an average GPA of a 3.9, test scores of an average of 1250, and many of you have completed an average of 12 or more AP, honors, or IB classes throughout your high school career. So we are incredibly proud to welcome you here today. We hope to answer a lot of your questions, give you more insight into our university, into the college itself, and we hope to see you soon and certainly connect with you even more over the coming weeks.
To welcome you on behalf of the faculty of the College of Nursing, the Davis and Henley College of Nursing here at Sacred Heart, it's my pleasure to introduce the Dean of the college, Dr. Mary Alstonius.
Good morning, and thank you, Rob. Good morning, everyone. It is my immense pleasure to be here to speak with you today. This is a new role for me in not being able to see you physically present, so I think it's going to go well. All of you who have been accepted are really an impressive group of men and women, and we are excited to welcome you into the class of 2025. Just briefly, I want to share 3 things with you. First is that the goals for our program are consistent with the goals of the university, and that is that we prepare for an educated person and an educated professional. That's the way our curriculum is designed, to include both liberal arts and science courses as well as nursing major courses. Secondly, we have a unique definition of nursing that drives our curriculum, and that is that nursing is caring with compassion, empathy, and altruism with the intention of healing body, mind, spirit. That embraces what we believe is a very holistic approach to nursing and nursing care. And thirdly, it is the professionalism of our students that I am most impressed with. So I am impressed with you who are coming, but I am most impressed with who are here, and especially our graduating seniors, and the way they are transitioning to professional practice in the work world. We always say that we believe that coming to Sacred Heart for the nursing program is critically important to providing the next generation for the nursing workforce. And we believe it's our students who will carry the heart of nursing, because after all, we are the Sacred Heart of nursing. Thank you.
Thank you, Dean Donius. To welcome you on behalf of our nursing students here at Sacred Heart in the Davis and Henley College of Nursing, I'd like to introduce Emily. Good morning, Emily.
Good morning, Rob. Good morning, everyone. My name is Emily. I am a senior nursing student from Rhode Island. Over the past few years, I've been involved in all areas of campus life here. So I am a part of the Davis and Henley College of Nursing, and that has been a major part of my personality here. I've been involved in the Student Nurses Association, which is kind of a way to get us involved out of the classroom and helping kind of form those connections, do food drives, build with the community. I've also taken a part as a peer mentor for the incoming freshmen and transitioning into sophomores. So I'll take about 10 or so freshmen, get them acclimated to the program. We can get food outside of campus, do fun little events just to kind of help them transition. I've also been a part of Student Ambassadors, which is helping run open houses and giving tours around campus. So that's been another really great outlet for me. But yeah, overall it's been a really incredible experience. I've also had some study abroad opportunities that I'll talk about later on, so very excited for today.
All right. So we have a lot to get through today. We are going to try to get as much information to you as possible regarding the nursing program and everything that's included with that. We're also going to try to get to as many of your questions as possible. Just to let you know, for those questions that we may not get to answer today, we are going to compile these questions and get them out in some format over the next couple weeks. This is not going to be the only time that we're going to be communicating with you in this fashion. We're going to be doing several of these live chats on all different topics for the class of 2024 as we look forward to the next couple weeks. And the last thing before we start is that we are coming live to you today from the Center for Healthcare Education, which is the home for the Davis and Henley College of Nursing, as well as the College of Health Professions. And an interdisciplinary approach for those students within the healthcare fields, this building provides our students with state-of-the-art technology and experiences that are highlighting their academic achievements at Sacred Heart. And we are going to be providing a virtual tour of this facility to you over the next coming weeks, so make sure that you watch your emails for that. So we are going to first start off this morning with talking about the program as a whole. And I'd like to start off with Dean Donius talking about what are some of the highlights that students can anticipate in coming to the nursing program at Sacred Heart.
Yes, Rob. I'd like to address it by year.
Yeah,
So
okay.
as you enter our freshman year of studies, all of the courses that you take are preparing you for the nursing program itself. So the sciences are prerequisites are critically important, and they are A&P, chemistry, and math. And the humanities are equally as important, for they are the ones that help you to begin to understand who you are as a person and how you offer yourself as an authentic presence for those for whom you care. Our advisement process for freshmen is very intense. All freshmen will have a nursing faculty member as an advisor, despite the fact that they're in the College of Arts and Science courses, so that the rigor of those courses is supported by academic advisement by the nursing faculty. In the sophomore year, the clinical courses begin, and we do have a clinical opportunity both in the lab for practicing and learning basic skills, but also in long-term care for caring for the geriatric or elderly patient. That's a unique feature for our program, is that clinicals do begin in the sophomore year. And then in the junior year, we begin the specialty areas. And this is what students really love, is to be in clinical areas with OB, pediatric, psych, and adult health and medicine and surgical nursing. So that's a very intense year. And senior year is really where it all comes together. The senior fall semester is an advanced course in med-surg nursing, and then the public health course and the transition course, where students then go out into the field with a preceptor to learn the side by side a practicing nurse, what it feels like and what one does in real life practice. So it's a quick pace, 4-year program. It's highly rigorous, as I'm sure Emily will attest
Yeah.
to, but it's also filled with support and quite a bit of fun.
Yes.
Our global programs that I'm sure Emily will speak to as well, or we can
Yeah,
speak
well, yeah,
to
yeah.
later, are wonderful opportunities for students to have a transformative experience.
Now, one question that I know we get a lot from with families that are going to be coming to the nursing program is that the nursing program is a direct entry program.
It is.
So there's no test-in option
No.
from freshman year to sophomore year, correct?
That's correct. What we say is that everyone who is accepted into nursing has the opportunity to stay and graduate, all things being equal. We know we do lose students. We lose students for a variety of reasons, especially in the freshman year. One is the rigor of the program that is unexpected. So students sometimes feel that it's a little bit much at the freshman year and choose to opt into another major. We lose students because of homesickness. That's a reality, despite the fact that we try to support all of the students in their transition to college. Some just need to go home
Yep.
and choose to go home. And then the rigor of the program, the academic standards.
Yeah.
But we have all kinds of help in terms of tutoring, in terms of, we have a student success center for the university, as well as a student success center in nursing for the nursing courses. So there's an awful lot of support.
And the rigor, the challenges of the nursing program are not necessarily limited to Sacred Heart. It's
Oh, no.
no,
That's
that's something that the students would get in most programs that they
Right.
go into in nursing, correct?
common practice.
Okay, all
Common
right.
practice.
Emily, when you came in as a freshman, can you talk a little bit about your personal experience in the transition into the nursing program here, and then talk a little bit more about the transition from freshman year to sophomore year?
Right. All right, so certainly for me, coming in as a freshman, there was a lot more to it than just getting used to the classes and the rigor of the courses. And I am very thankful that this program is set up in a way that you don't start your nursing-based courses until your sophomore year. So freshman year, I could learn about the things about how to make macaroni and cheese at night and do my laundry and just make new friends. And I could actually focus on that aspect of the transition into college. And of course, I was taking the chemistry, the biochem. We had a math application for healthcare majors. Things of that nature was difficult, and I think it was not at a tipping point for me. It was just enough where I felt challenged, but I also could focus on talking to my parents back home and making new friends. So I felt like it was the perfect balance between school life and academics and friends and family. And then certainly going into your sophomore year, I did notice a difference, because that is when you start the foundations of nursing, the pharmacology. You really get into the mindset of a nurse starting your sophomore year. And with that, I used all of the knowledge that I'd previously put aside my freshman year about all my studying habits and just kind of time management. And I was able to use those and build upon it in my sophomore year. So even though it was a much more difficult course load, I was able to handle it all just the same because I had the tools. And same for my junior and senior year. They continue to build up the rigor of those courses and make them more complicated because you are building on previous knowledge. But in the same way, you're building on previous study skills and you know yourself better. So it never has really felt any more difficult or strenuous, because I know myself better now, and they really coordinate the classes in a way where you feel comfortable making that transition each year.
Okay, very good, thank you. Pam, we're getting a couple questions in today about nursing and then also the honors program.
Okay.
So why don't we talk a little bit about the honors program
Sure.
for those that have been accepted,
Sure.
also those that may have not been accepted.
Sure.
And then we can continue with some more questions.
Okay. Well, very similar to admission to the nursing program, the honors program also comes with certain standards of rigor as well for admission. So for those of you who were offered admission to the honors program, I do encourage you to complete the form to accept your seat in the honors program. There are some courses that you will take throughout your career here that are honors specific courses. Also provide you an opportunity to the living and learning communities across campus as well. For those of you who would like to apply for consideration to the honors program, you can do that now. Please do reach out to your admission counselor. Let them know your interest, and we will be working with our honors program director to review candidates who are hoping to gain a seat for this coming freshman class. This is not the only opportunity you have to apply to honors. You can also apply during your freshman year. So there are a few opportunities to participate in the honors program.
Yes, and for those of you who will be in the honors program, some of the amenities that come with that is special housing in the Honors Living Learning Community, which is housed in Toussaint Hall on campus, and then also honors specific activities and academic sessions that you'll be conducting actually within the hall itself during your freshman year. So for those of you who have been accepted and would like more information on the honors program, or those of you interested in learning about the honors program, you can visit that information on our website at sacredheart.edu. One of the questions, a lot of it is coming about clinicals now. So let's start first with how clinicals begin, which begin in the sophomore year, and what that is, and then how they progress from there. So we'll start with Emily first. So talk about your sophomore year clinicals.
Sophomore year clinical. Well, I was a little bit of an exception for this because I chose to go abroad for that semester, my spring semester sophomore year. And while I was over in Ireland, I had the opportunity to go on the post-op orthopedic floor while I was there. So we do about a total of, I want to say it's 18 hours or so.
About 2 days.
About 2 full days of nursing care. So I was able to, mostly it's for getting used to being at the bedside. So I was doing vital signs, getting used to using therapeutic communication, just becoming comfortable with myself in scrubs at a patient's bedside. So it was really incredible to be in Ireland, learning their healthcare system, giving care for the first time, being with all my other 20 students that were with me, kind of going through it together. So it was a really nice ease into the clinical setting.
And so around here, for those students that are in the Fairfield campus, their sophomore year, and we'll get to the study abroad section in just a few moments, but students are basically working in long-term care convalescent centers in our local area.
In our local area, and
Yeah.
oftentimes the next question is, does a student need a car?
Yeah.
And not at the sophomore year. Everything is within walking distance. So
Yeah.
the two primary places are the Jewish Senior Center and Ludlow long-term care. So students have an opportunity to walk from campus to those areas or take a shuttle to our campus and walk to the Jewish Senior Services.
Now, to correspond with that and functioning in this facility, which is, again, the Center for Healthcare Education, could we talk a little bit about the sophomore year bedside care lab that our students will be engaging in?
Yeah, I hope most of you have already seen our building and our labs, because they are difficult to explain if you haven't seen them. They're very, very impressive, and it's no lie to say that they are state of the art, and we are an exceptional program to have this quality of opportunity to practice in simulation that way. So we have 24 beds with head walls that mimic a patient's room, and we can have up to 48 students practicing and learning together with faculty in that area. And that's where the sophomore labs are held, and I'm sure Emily can speak to that too. But it's an incredible experience to see the students learn in that environment.
Yeah.
And then be able to practice.
Exactly. Emily, you want to talk a little bit about the bedside care lab?
Yeah, I'd love to. So that was actually one of my favorite lab experiences, because that's when you're really just for the first time putting on your scrubs, getting to walk into a lab. And one of the first things we did as a first semester sophomore year was learn how to do different kinds of injections. So I remember getting checked off. You get like a little fake skin pad and you have to learn how to give a shot. You're not going to practice on each other, which is good in this day and age. But once you get checked off by a nurse, you're actually able to help run Sacred Heart's flu clinic. Mm-hmm. So I was able to give all of my best friends their flu shot my sophomore year of college, and I kind of worked down the list of who I thought trusted me the most. But it was a really incredible way to get comfortable with a needle in my hand, and they walk you through it so that it's comforting the whole time. But yeah, that's probably one of my favorite kind of lab experiences looking back on it, because that's where you're learning how to give a bed bath and how to change a patient's sheets and how to do wound care and give different kinds of medications. So it's all just like the foundations that you use every time you walk into a patient's room.
Progressing after sophomore year for clinicals, Emily, talk a little bit about what happens junior year.
So junior year, first semester, you're going to be in your obstetrics care and maternal health, as well as mental health. So you'll do half of the semester, so 7 weeks with either OB, and then 7 weeks with mental health. And I personally love this combination because I started with my mental health rotation, so pretty much any patient you're ever going to come into contact with is going to have a mental health issue to some degree. There's no perfect human out there, so getting that initial step into that specialty really helped me feel comfortable in any setting I was walking into. And then once we progressed into OB, I was able to scrub into an OR, do 3 live cesarean births. I saw a live vaginal delivery. I was able to do baby mother, postpartum care. I was in the NICU for a week, so it was a really incredible just 7 weeks of all those different disciplines for one clinical.
Okay.
And then spring semester?
Spring semester is junior year, yeah.
So that's when I really focused in on med-surg, which is, when you think of nursing, that's what med-surg is. You walk into a hospital, you could be caring for a respiratory patient, cardiac, any kind of endocrine deformities. So that's just like your basic nursing care. You're kind of putting together all of the knowledge you've had over these past 2 years.
All right, and then senior year.
Senior year, now you're in med-surg too. So that's like the complications of complications for nursing, for patients in general. So your patient could have COPD and they just had a cardiac arrest and now they're on a ventilator. So you have to take in all these considerations. They could get pneumonia now from their ventilator. So you're always thinking of just the different parts of the body that you've learned about and putting that all together to kind of synthesize it and care for your patient with the best aptitude that you can give them. And I was also a part of my pediatric rotation, so I actually went down to Guatemala for a week and completed all of my pediatric hours down there, and that was by far one of the best experiences I've had in my entire life, not just at Sacred Heart. It completely changed my perspective on family, health, love, all of that. It was just one of the most warming, best feelings that I've ever had walking out of just 1 week of clinical care.
And in talking a little bit more about clinicals, let's talk a little bit about the sites. So we use both hospital clinicals,
Yes.
And there's also some outside the norm kind of clinicals that students may not even think about, such as school nursing,
Yes.
home health care, things that all students in the nursing program should be prepared for. So I'm going to start with you, Mary Alice. Talk a little bit about some of the agreements that we have with hospitals in our area and what students can expect from that.
We have a variety of acute care institutions and health agencies that work with us, and we're very pleased about the reception our students receive in these hospitals because of the reputation of people like Emily. And as you can see, Yale Health System is probably the largest health system that we use, and students have all kinds of opportunities there. But within the Yale Health System, we use Bridgeport and Greenwich most commonly. And then we use Stanford Hospital as well.
Okay.
So those are the major acute care, but we are in visiting nursing, home care, in school-based clinics. Hall Neighborhood House, which is an affiliate with us, is generous in for public health with their senior population, with their pediatric Head Start program. So pretty much wherever there are families and people in need of health care and health education,
We're there.
we're there.
Okay, very good. Emily, I know a lot of questions always come in when pertaining to clinicals about transportation to clinicals.
Mm-hmm.
So talk a little bit about that junior and senior year, about how students get back and forth to the clinicals.
Right, so junior and senior year is when you're expected to drive back and forth to these clinicals, but I've always done carpools with my friends, so we'll trade off every 5 or 6 weeks or so, and someone else will take the car. But with that also, they always try and take into consideration if you were 5-10 minutes down the road this semester, they might put you 30 to 40 minutes away next semester. Whereas if you were an hour away with traffic one semester, they're going to bring you closer to another 10-minute drive down the road for your clinical setting the next semester, which I've always found to be true. And I've done a variety down at Stanford. I've been just down the street at St. Vincent's Hospital. I've been at Yale New Haven. And just this past semester, I was at Stanford at a satellite campus and their OR setting there. So they really do take into consideration where you've been, and they try and equalize it for everyone.
Okay. One of the questions that we're seeing coming through a lot has to do with the ability for students to have some assistance outside the classroom, whether or not that's through the nursing program or through our Student Success Center here at Sacred Heart. So let's talk a little bit about how we provide students with that assistance, because not only adjusting to college academics their freshman year, but also adjusting to the plan for nursing that they'll have to do for 4 years.
Right. The first thing I want to say, if people if students are coming with having had accommodations in high school, please make sure your students have the accommodations when they come to college. Oftentimes students feel that they don't want to continue them, they don't need them, or they don't want to be labeled. The hardest thing for me in my role is for a student to fail a course and say, I should have registered for accommodations. I can't do anything after the fact. So my first plea is to, if you have accommodations in high school, please continue them in college. You may never need them, but if you don't register, we can't give you those. And we do honor the accommodations, and they are very confidential for the student. So the Student Success Center for the university handles those. We then have different types of student success programs here. So we have a tutoring session for our students like Emily, who have done quite well. They're available to tutor students in courses that they are taking, particularly A&P, some of our nursing courses, and we find that the students who use our CLAs are very, very comfortable, and it's not as judgmental an interaction as it might be with faculty. But I have to say, our faculty are incredibly engaged with our students and accessible. If a student is struggling or having difficulty, the sooner they can acknowledge that with the faculty member, the better. Every faculty here is responsive.
And I think that's something that is a moniker of what Sacred Heart stands for, but I think it's very evident in the Davis and Henley College of Nursing,
Yes.
Because of the closeness of the faculty to students.
We have 2 adjunct faculty who work with us in the labs, who plan experiences, supportive experiences for students who are recommended by their clinical faculty for skill development or integration of knowledge and skill. So we feel that the students have every opportunity if they take advantage of it.
So we're about halfway through our chat this morning. I want to welcome you all again. My name is Rob Gilmore. I'm the Director of Campus Experience in the Office of Undergraduate Admissions. And for those of you joining us who've been accepted for the Sacred Heart Class of 2024, we welcome and congratulate you. For your parents or family members who are also watching today, we certainly welcome you, because this is not a decision that the student is making on their own and looking where to choose for their choice of higher education. And it's also not a path they're going to be taking alone. When they commit to Sacred Heart, the whole family commits to Sacred Heart. That's what makes us a pioneer family here at the university. We are coming to you today from the Center for Healthcare Education on our campus. This opened in 2017. It is the home for the Davis and Henley College of Nursing, as well as the College of Health Professions. And I am joined today by Pam Pillow, Executive Director of Undergraduate Admissions, Dr. Mary Alice Stonius, Dean of the Davis and Henley College of Nursing, and Emily Palma, one of our senior students in the nursing program here. I want to turn it back over just a few moments to Pam from admissions to talk a little bit more about this class.
Sure.
And then also what the next steps are going to be.
Sure. Well, congratulations once again to those of you who may have logged in a bit late. We are welcoming our highest qualified candidate pool to the Davis and Henley College of Nursing today, and it's an honor to do so. Thank you for logging in virtually this morning. Next steps for you all is obviously to ask your questions. Today's forum is a nice opportunity, and we will be sure to answer any questions that aren't covered in our talk today. Follow up with your admission counselor if you do have questions, either about the program, Sacred Heart in general, financial aid. We will be sure to get you all the information you need, and as Rob mentioned, we will be hosting as many virtual chats and virtual opportunities to connect with you, and as soon as we are able to, hopefully connect with you in person as well. May 1st is our deposit deadline here at Sacred Heart, although we recognize this is a rapidly changing situation that we are living in today. So we will be monitoring and following any guidelines proposed by NACAC, the National Association of College Admission Counselors, in terms of next steps. But as of today, May 1 is our deposit deadline. So once you deposit, you will receive additional information about orientation, which is scheduled for the middle 2 weeks in June. It's a 2-day orientation to the university where you learn a lot more, get to connect with students in your class, maybe choose a potential roommate, and also select your courses for the fall.
And just for the students out there that are not already logged into our Facebook group for the class of 2024, please request to join that. With the news evolving every hour, it seems, that is going to be a big area for us to contact you through over the next couple weeks. So make sure you're on the Facebook group. That's also a great way to meet other students at this point, so that you get to share your experiences and talk a little bit about yourselves in that group. Also, please make sure that you're looking at our admitted student website as often as possible, and that is welcome.sacredheart.edu. There's a lot of great resources on there for you to look through during this time, not just for the student, but also for the parents as well. So we are going to ask you to keep sending your questions in. We are receiving hundreds of questions already this morning. We are not going to be able to get to all of them, but we will try to get to as many as we can. And we are also going to take the questions that we aren't able to answer today and put them into some kind of chat format that we can send out to you virtually over the next couple weeks, so we can get those questions to you that you'd like to get answered. So a few moments ago, we were just talking about clinical placements here in the College of Nursing. And a lot of questions are coming in about clinical options in states outside of Connecticut.
Yes.
So can you talk a little bit about how that would work and what students can anticipate?
Thank you, Rob. Yes, we do have out-of-state options for our seniors in their transition course, their final precepted course in their senior year. We have arrangements with Robert Wood Johnson St. Barnabas in New Jersey, where students who live in New Jersey or want to practice in New Jersey can do that precepted experience there. We also have an agreement with a hospital in Massachusetts in, I think it's Bedford, and I'm sorry, I forgot the name right now, but so what we're trying to do is to identify areas where students come from who may want to go back to that area to practice, and then develop relationships with our clinical partners within those states to plan for experiences that those students could be then hired following graduation.
So up until second semester, senior year, all clinicals would be at Connecticut-based, okay?
Right. Unfortunately, I know we have a number of people from New York State, and New York State Office of Professions that regulates nursing programs does not allow for out-of-state licensure programs like ours to come in and offer clinical experiences for their hospital areas. So we're not able to do that in New York State by regulation.
So outside of the clinical opportunities that students are required to do through us here in the Davis and Henley College of Nursing, students are able, though, say over summer, to work at a hospital in their area, correct?
Yes. We have a number of students who do internships within their home areas. Our faculty support that. They offer all kinds of advice as well as recommendations when the students come to us. If we receive something from an institution in another state, we send it directly to the class, so students have the opportunity to review it and apply if they so choose. We also have an opportunity for, we have 3 usually 3 internships in an oncology fellowship, the Susan Flynn Oncology Fellowship, and we've had
And that's
students,
through Stanford Hospital, correct?
well, some in Stanford. We have one in Stanford. We had one in New York Presbyterian,
Okay.
New Hampshire. So Mr. Flynn, who is the person who runs the foundation for this fellowship, he has a number of different contacts across
Okay.
hospitals in the East.
And we've had several students
We've had
be able to get that
2 to 3
fellowship
a
over the
year.
last, yeah,
Mhm.
okay. Question I want to direct to Emily, because she has the most interaction with our faculty here in the Davis and Henley College of Nursing. Why don't you talk about the faculty we have here and how you are able to learn from them and also interact with them on a daily basis?
Absolutely. So I think for me, coming to Sacred Heart, I wasn't really looking into a small versus a big school versus medium size when I was comparing all of my choices. And I just got extremely lucky with the school that I chose in regards to, we have such a small student to faculty ratio here. My class size has never been over 28 students, and I think that was my anatomy my freshman year. So needless to say, by the end of each semester, I have formed a full relationship with each of my professors. They know me by my first and last name. They know aspects about my personal life. I know I can go to them at any given time in a day to go and just sit down, have a Jolly Rancher, have a cup of hot chocolate, and just talk about life, talk about nursing, really anything going on. And I'm beyond grateful for that Sacred Heart has given me. It wasn't anything I was expecting to get or looking for. I just kind of fell into it. And I've certainly found with this program that whatever kind of time and effort, dedication that I put into the program here is exactly what I get reciprocated back to me. And that's been one of the best parts about this program, because I know myself and I love getting to know people. I am very dedicated to the work that I do, and I love seeing that given right back. It's very comforting, and yeah, it's been a really great experience so far.
Mary Alice, do you want to add anything to that?
I do.
Yeah.
Our faculty are extraordinary. I've been in nursing education for longer than I care to admit, well over 35 years, and I am just so impressed by the men and women on our faculty. And as you can hear from Emily, she lives the experience. I think it's the nursing nature of our faculty and their passion for nursing that extends to our students. So what they had traditionally chosen nursing for and given to their patients is now given to their students in the context of becoming, of helping the students become a professional nurse. So I'm most grateful and most proud of the faculty in our program.
One of the things that is a highlight of this program, I think, is our preparation of the students in way of the NCLEX, which is the national licensure exam that students will be taking at the end of their time here. So let's talk a little bit about how those numbers look for us, and then also how our students are prepared. And we could start with Mary Alice and then transition to Emily, who is getting ready to get into that phase of her life right now. So Mary Alice, go ahead.
Yes, well, I think our pass rate, I know our pass rate last year was 97%, and I can tell you that the faculty, when we don't achieve 100%, is disappointed. That's their goal, which we have had.
Yes, we have been at 100%.
100%.
Yes.
We have the highest NCLEX pass rate in Connecticut, for which we're very proud. And the plan for developing success in NCLEX doesn't start at the end of the senior year. It starts at the beginning of the sophomore year, so that our faculty have embedded the way in which questions are asked that's based on the critical thinking and critical decision making that nurses need to know. So that is the platform for how the NCLEX preparation begins. So it's woven all the way through the sophomore, junior, and senior year. The questions on the exams are asked the way the NCLEX questions are asked. Unfortunately, you have to go a question at a time, and you can't go back and change your answer. So students get used to that method of examination. And then again in the senior year, we reinforce that with practice tests, with opportunity to see where your weaknesses are and where your strengths are, and support for learning those areas or beefing up those areas. So it's a 3-year process that's well integrated into our curriculum, and I think that's different than many other programs.
Yeah. And Emily, why don't you talk a little bit about that process beginning sophomore year for the NCLEX prep, and then how you're getting ready to take the test this coming summer.
Right, so I just want to say, first and foremost, I feel like I'm ready to sit down and take this right now. Like, they have done an incredible job of preparing us for this exam. So starting our sophomore year, all of our nursing exams are on a computer basis. It's set up the same way with the same wording, the same formatting as you'll see on the NCLEX exam. There is no backwards navigation, as Dean Donius was saying, which is a little bit of an adjustment at first because you're so used to being able to either flip through the pages to go back and see what you put for answer 2, or click back to go back to see what you did beforehand and gear your answer towards that. But in the NCLEX, there is no back button. So once you submit an answer, you have to move forward. And getting used to that adjustment of like, oh my gosh, I think I just put the wrong answer, you get caught up in it. By this point in my senior year, I could care less what I just put. I'm focused on this answer and this answer only, and I'm moving forward. And I think that has a huge significance when taking the NCLEX. And right now I'm actually enrolled in a course that's specifically dedicated to getting us ready for this examination. So every week I have about 200 to 300 practice questions that I have to do, and then take an analysis of and hand it to my teacher, and they'll break down and they'll see, oh, you got 3 questions in a row wrong here, and you got the majority of your questions wrong towards the end. Were you starting to fall asleep? Did you lose focus? You know, you need to get up and move around, take a deep breath. So they really help every single week of this semester gear your head towards getting in the mindset, understanding your flaws, building up your strengths, and I'm ready. I'm excited.
That's great.
Yeah.
And that's what all our students feel the same way. I think that's something that I definitely have seen over the years, that the anxiety once a senior year has ended has been lifted, getting ready to take the NCLEX because of the preparation here.
I just want to add that for the few students who don't pass on the first time, that reported NCLEX score is first time pass.
Yeah.
No one has ever had to take it more than 2
Twice.
times.
Yeah. So we have a 100% 2-time pass rate here at Sacred Heart.
Yes.
As we've been saying, we're coming to you live from the Center for Healthcare Education. This was a facility that was opened in 2017, and just the way that the building is constructed provides 2 things. One, there's a lot of natural daylight in here, which is helpful in any kind of learning atmosphere. But also it provides an open type of academic space where students, faculty, staff can all congregate together. So Mary Alice, why don't you talk a little bit about the building, and then we'll talk about what specific components we have in here just for the College of Nursing.
Okay. The building is extraordinary. It's beautifully built, and it's welcoming from the front door through all of the spaces. The faculty or the leadership of nursing in the healthcare professions were actively involved in designing the interior of the building. We worked with SLAM as the architectural firm, and they were terrific in guiding us and helping us understand movement through the building and what we needed to do to actualize what we had envisioned in terms of education in simulation and basic skills for our students. So I think there is a video that's going to walk everybody through, so
Yes.
you'll be able to see it. The main areas for us are the basic skills lab with 24 beds and mannequins for the sophomore students. When students reach their junior and senior year, then they move on to the opposite side of the hall to the simulation room. And it is an acute care simulated hospital.
Yeah.
We have 8 simulation rooms with pediatrics, obstetrics, and medical surgical nursing. Everything from basic patient care to complicated patient care with tubes and vents and all kinds of things. Everything that you would see in an acute care setting, you will see in our simulation room. And students really are wonderfully excited about getting into those labs and being able to practice. There's a home care suite that is used between OT and the College of Nursing so that students can actually practice how to enter a person's home and treat a person within a home care setting where supplies and other things may not be available.
Yeah.
And then we have 6 primary care labs. So they're set up just like primary care offices.
Okay. And in the simulation areas that we have 2 high-fidelity mannequins that our students that work on, correct?
Oh my goodness, we have probably 10 to 12.
Oh, 10 to 12, yes, yeah.
We have 2 4G mannequins.
That's 4G, that's the ones I meant, that's
those are the
4G,
big-
yeah.
And these
The
are
high-priced
the
merchandise,
Yeah.
yes.
The 4G mannequins are used in labor and delivery, and those poor mannequins deliver daily and constantly, and not only deliver live births, but deliver and have complications. So they seize, they hemorrhage, they do all kinds of things. Their blood pressures bottom out, and the students respond, and
Yeah.
they're learning to respond appropriately, and the faculty are with them in the simulated experience, and for the most part, the faculty will stop the simulated experience if decisions are being made that have severe consequences, or they'll let the consequences ensue and then have the debriefing as to where the initial wrong decision or error in decision was made.
Emily, what's your favorite part of the Center for Healthcare Education?
I'm going to have to go with our junior and senior suite. There's nothing else that I've ever seen like it. You walk into it and it just feels like you're on a hospital floor. You walk in, there's the nursing suite where all the nurses congregate and go over their charts, which is where we do our debriefing afterwards and our course of action before we walk into the room. You have the medication prep room with a little Pyxis and all the supplies in the closet, just like you'd see when I go all the time at clinical. It's the same exact setup, and then you just have a whole strip, a hallway of different specialty rooms. Like Dean Donius was saying, we have quite a few med-surg patients, some pediatrics, a little NICU. We have the labor and delivery suite, which was where I delivered my first child. And we also have like a geriatric setting as well. So it's just very comforting knowing that I can walk up there, nothing feels out of place, and when I go into clinical, I feel like I'm at home. There's nothing that's out of the ordinary for me. I know how to work a headboard, I know how to put an N95 on, I know how to set up the IV, I feel comfortable grabbing supplies.
And within the simulation suites, we also have data capturing capabilities where student pairs and their instructors can watch the simulation as it's happening from another room and be able to report back, correct?
Yes, and also everything is audio and video recorded, so the students can watch it at a later time too.
And see what may have done
transpired.
wrong. And,
Yeah.
Okay.
So the other room that we do have is our advanced health assessment lab, which is for our nurse practitioners, but housed in there is something called an anatomage table, which is a virtual cadaver. We have 3 virtual cadavers that have been, as someone told me, sliced and diced and then put back together again through an MRI. And we can literally look at a cadaver from the skin all the way down to the bones, and then build it back up with nerves and blood vessels, muscles, a musculoskeletal system. It's incredible.
And we're one of only 2 colleges in the state that actually have one of these tables,
Yes, I think-
us and UConn Health.
Yes, and I think UConn is in the medical school, so
Yeah.
Right.
we're
Ours
proud
being
of
available
it.
for nursing
Yeah,
is
we're
the
very
first.
proud of that.
Yeah. One of the things that we have talked about a little bit earlier that is actually one of the huge components to what makes us different from a lot of other nursing programs is our study abroad program. You know, a lot of students who are looking at multi-nursing programs during their college search will find that a lot of nursing programs don't advise students to study abroad. That is not the case here at Sacred Heart. In fact, we encourage it. And so we've, over the last couple of years, developed certain programs at a few locations where our students can study abroad. So talk a little bit about that, Mary Alice, and then we're actually going to talk to Emily, who has done both a study abroad semester and then also a immersion trip with the nursing program. So we'll start with
Sure.
the Adonius.
Our two study abroad semesters that link in with our current curriculum so that students don't have to extend a 5th year. That's common when a nursing student goes abroad in another program for a semester. So our first one is in our Dingle campus, and we have 48 students there now on our Dingle campus, and they go to class just as they would. We have our pathophysiology course is a synchronous course online with our faculty here, and our health assessment course is taught by 2 nurses in Ireland who have New York State or Connecticut State now license. So we do send our faculty over periodically to make sure everything's going smoothly, but it's a wonderful experience. And then, as Emily said, you get to go into an Irish hospital in Tralee. We have affiliation with Bon Secours and with University Hospital Kerry. So our students actually see Irish patients in a healthcare setting. And then our Australian partnership is with the University of Notre Dame, Fremantle, and that's an OB experience. And the students go to class with those students at that university in their nursing program, and then they come back they start earlier in August, and then they come back to our campus and do the OB clinical experience.
So we have the sophomore spring semester, which is in Dingle. We have the junior fall semester, which is at University of Notre Dame, Fremantle.
Yes.
And then we also have the 2-week junior nursing leadership course in Dingle, correct?
Yes, we're going to do one in the winter now.
Okay, perfect.
In
Nice,
the
adding
winter
another one.
semester, and we're going to do one, we always do one
In the spring.
And one of the things that I love about our programs is that we do our ceremonial blessing of the hands every place we go. So our junior year, that's one of the most special experiences and meaningful experiences, I think, for students and for faculty and for families, is the blessing of the hands. So we do that in Ireland, Australia, and we do it in all of the immersion places as well.
Very good. So Emily, you're the one who lived it firsthand, nursing in Ireland. Why don't you talk a little bit about your experience and then also your recent immersion trip that you did?
Right. So I just want to start off by saying the study abroad experience specific for nursing students is one of the major aspects that set Sacred Heart apart from other schools I was looking at. I knew I wanted to go abroad. I wanted to get that full semester experience, but I also knew I wanted to graduate on time and do the classic 4 years of your bachelor's. So Sacred Heart for me was the perfect fit for that aspect. And when I went to Ireland, I wasn't really sure what to expect. I went with a group of about 26 nursing students at the time, so enough to fill up a classroom. And I was still taking 5 classes while I was there. I was doing my clinical experience. I had lab time, and it was actually just right connected to our classroom was the hallway of all of our little labs. It's actually where all of the nuns used to sleep. So it was all of their little bedrooms. We got to play with all the instruments in the room because it was set up. There was a bed that we could do all of our head to toe examinations on, learn how to use the stethoscope, blood pressure cuff, things of that nature. So it was connected right off of our classroom, which was pretty neat because here, you have to walk upstairs and go into a lab, whereas we just did it right at the classroom. And when we got to do those clinical experiences in Bon Secours Hospital, which is where I was, it was just really special being able to compare American healthcare to Irish healthcare. One thing that they don't stress as much over there is all the kind of documentation, and some of the patients didn't have bracelets on that identified them. And I remember being over here before that and thinking, oh my gosh, there's so much documenting to do, there's so much patient identification. But once I saw that healthcare setting, I am so thankful. I am happy to sit down on a computer now and chart because it's just much more organized the way we have it here, and being able to see those discrepancies made me appreciate our healthcare system much more, which I wasn't expecting to learn either. And then I spoke on the Guatemala immersion trip a little bit earlier, but again, that was just a week long. I did that last fall as my junior pediatric rotation to get all of those hours done, and we basically every day we brought our suitcases with us, would load them up with all of our supplies, toys to give out, medications, different kinds of bandages, all sorts of injections that we could give to the patients that we were serving for maternal and child care. And every day we went to a different town around the city of Antigua, Guatemala, and completely set up a clinic. And then at the end of the day, we broke it down and moved to a different location the next day. So it was just the most awe. The people there are so kind, they're so welcoming. I felt so safe and welcomed. It was just something that I'll never forget, and I'm looking forward to going back as an alumni.
Mary Alice?
Yes, we have, in addition to Guatemala, we have two other international immersions. One in Jamaica that we set up usually in the fall and spring, and as Emily said, we take a number of supplies to those areas to distribute while we're there and to leave, so that people are sustained once we do leave. We have a new experience for seniors in the fall in Ghana, in a medical clinic in Ghana associated with the Holy Name College of Nursing and Training, I think is how they refer to their college. And 17 students went to Ghana in the fall. And then we, unfortunately, we've had to postpone our week immersion with the health wagon in Virginia. So not only do we have international, but we are now expanding into national need.
Oh, very good. So we have a few minutes left, and we're going to actually kind of do a rapid fire question here. We have a couple questions. So we're going to try to keep our answers nice and short so we can get through as many of these as we begin to wrap up. So the first one is, how many students in a clinical rotation?
It's usually a 1-to-6 ratio.
All right. So,
and then sometimes pediatrics and OB, it's 1-to-4.
Yeah. Students are guaranteed a preceptorship their senior year?
Not guaranteed. What the hope is for a preceptorship, but the faculty determine where the learning need for the student is. So if the faculty identify that the learning need is still within a group, then we assign students to a group. But that's very, very few. But some students, everyone looks forward to, I think, a preceptorship. But some students understand that they need a little more guidance and a little more oversight.
For Pam, how many students applied to the nursing program and how many were accepted this year?
We had close to 2,200 applications this year. We had 800 full accepted students to the nursing program.
Emily, are there any religious course requirements outside of nursing at Sacred Heart?
Yes, so part of the curriculum here, you take 2 Catholic Intellectual Traditions courses, part 1 and 2. Those are actually 2 of my favorite courses that I've taken here because it's all discussion based. It's kind of like a stress reliever course, how I saw it. And then you also take 1 religion, which I took when I was over in Ireland. I actually got to take Celtic religion, so I learned all about their gods and goddesses, and it's pretty neat.
All right. Are there clinical hours on the weekends?
Yes.
Okay.
Our agencies, our facilities are asking us to extend our rotations through the week, day and evening hours, and especially on the weekends.
Okay. All right. Is there a specific computer or laptop that's required as part of the nursing program?
No, you can use a
PC or a Mac?
PC or a Mac.
Okay, all right. And laptops can be purchased through the university through our factory, which is a part of our information technology wing here at Sacred Heart. How many students are in the SIMs in the sim labs here in the building?
1-to-6.
1-to-6 again, okay, very good. And then finally, I'm going to give this question to you, Dean Donius, and then also to Emily. What makes us stand out from other colleges?
Well, as you can see, our students, this is the product.
Yeah.
Emily is a wonderful representative of the quality of our students who are graduating, which then filters down to the quality of our faculty.
Yeah.
And also what I want to acknowledge too is our place within the university. Sacred Heart University values nursing education and values the contribution of the college, the Davis and Henley College of Nursing, to the university. That's an extraordinary relationship. we are so proud to be able to explicate the mission of the university through our profession, and I think that is a distinguishing characteristic
Yeah.
of us.
Emily?
I'd say on a superficial level, this building as a whole is something that is really hard to find elsewhere, and it's something that I was looking forward to. I just saw it in PowerPoint slides when I was looking at the school, but being a part of it now, it's kind of, you can't put it into words how great it is to have these tools to work and go into the clinical setting with, and also the study abroad experiences. But more importantly, what I found through this program is just the connectedness of everyone here. It's the faculty with the students, the holistic approach that you can't really teach someone how to care for a mind, body, and spirit, but they set up our simulations and talk to us and engage the class in a way that we understand that connection, and we're going to put that forward with our patients for as long as we practice. So it's a very well-oriented family feeling that I've gotten from this program.
And on that, we're going to begin to wrap up here. It has been a pleasure to speak with you today in learning more about the Davis and Henley College of Nursing. Once again, for those of you who are watching or admitted students, congratulations on your acceptance to the Sacred Heart Class of 2024. This is not going to be the only time that we're communicating with you. We are going to be sending a lot of emails and texts and posts on the Facebook group and more videos to engage you, and we certainly invite you to contact our office if you have any questions or would like to engage with us a little bit more during these rapidly changing times that we are in. Just to let you know, immediately following this chat, it probably has actually already gone out since we are afternoon, there is a video link that's going to be sent to all students who have been accepted for the Davis and Henley College of Nursing that will show a full 9-minute simulation from our labor and delivery simulation suite. So you'll be able to watch that. And that was something that we were looking forward to showing you in person today when you were on campus for this event. But unfortunately that was not going to happen, but we are still giving you some very, very good video of that simulation. We are, just like I said, 45 days away from the May 1st deadline, which is an important time in your lives. So we want to make sure we get you to that spot in choosing where you're going to be going over the next couple weeks. So on behalf of the university community, Dr. John Patillo, our president, our board of trustees, our students, our staff, our faculty, as well as our alumni, for Pam Pillow, executive director of undergraduate admissions, Dr. Mary Alice Donius, dean of the college, Davis and Henley College of Nursing, and also Emily Palma, a senior student here. My name is Rob Gilmore. It's been a pleasure to be with you today. Have a wonderful afternoon.
Thank you.